Our knee replacement patients will start outpatient physical therapy 2 to 5 days after surgery. The patients will set this up on their own. You will call a physical therapist, one who lives near you so you are not traveling far. Tell them you're having a knee replacement and the day you would like to start physical therapy. Patients will attend physical therapy twice weekly, and the physical therapist will give you a home exercise program that you can do on your own when you're not in the physical therapy office. We do not require any formal physical therapy for hip replacements. Our only requirement is walking. We encourage all our hip replacement patients just walking every 2 hours as mentioned. However, we give every hip replacement patient a formal physical therapy prescription, and it may be beneficial. We leave this up to the patient to choose if they want to do formal physical therapy. If not, they can just walk at home. After a knee replacement, the block or numbing medication wears off 24 to 48 hours after surgery. When this happens, you will know. There will be increased pain as well as swelling. Walking, ice, elevating, as well as medication will help with this. Bruising and swelling are very normal after a knee as well as a hip replacement. You may notice bruising and swelling all the way down to the toes. This is completely normal and will resolve over the next couple weeks. The first 2 to 3 weeks after any joint replacement is the toughest, as there is pain and swelling during this period. This is very normal and will improve. Night pain is also very typical. Patients often have a hard time falling asleep and staying asleep at night. Again, this is very normal and will resolve. After a joint replacement, you will go home with a brown bandage either on your knee or hip. You can shower the next day. You'll remove the brown bandage. Underneath the brown bandage is a clear piece of mesh. This mesh is glued onto your incision. The mesh makes it waterproof as well as keeps the incision closed. Do not peel the mesh off until your post-operative appointment. You can get in the shower, soap and water runs over the mesh, do not scrub, pat dry, and you're all done. Knee replacements do not need to put a new dressing back on the incision. I do recommend putting a dressing back on the hip replacement just for the first 1 to 2 weeks. We rarely see any drainage or blood from the incisions. However, a few drops here and there are very normal. If you notice more than this, or if it's draining for greater than 3 to 5 days, please call our office at any time. Every patient is sent home with pain medication. We will discuss the most appropriate pain medication for you during your preoperative visit. In addition, every patient goes home with a blood thinner. This will either be aspirin or Eliquis, depending on you and your medical history. All medications are e-prescribed to your preferred pharmacy, as well as refills are e-prescribed to make the transition home much easier. We are available 24/7 after surgery. Please do not hesitate to call us with questions or concerns. You do not need to go to the ER or Instacare for any joint-related questions. If you call the office during business hours, we'll call you right back. If it's after hours, it will be redirected to our answering service and one of us will call you right back.